Sanitation refers to public health conditions related to clean drinking water and treatment and disposal of human excreta and sewage. Preventing human contact with feces is part of sanitation, as is hand washing with soap. Sanitation systems aim to protect human health by providing a clean environment that will stop the transmission of disease, especially through the fecal, oral route. For example, diarrhea, a main cause of malnutrition and stunted growth in children, can be reduced through adequate sanitation. There are many other diseases which are easily transmitted in communities that have low levels of sanitation, such as ascariasis, a type of intestinal worm infection, or helminthiasis, cholera, hepatitis, polio, schistosomiasis, and trachoma, to name just a few. The overall purposes of sanitation are to provide a healthy living environment for everyone, to protect the natural resources, such as surface water, groundwater, soil, and to provide safety, security and dignity for people when they defecate or urinate. The human right to water and sanitation was recognized by the United Nations, UN, General Assembly in 2010. It has been recognized in international law through human rights treaties, declarations, and other standards. It is derived from the human right to an adequate standard of living. Effective sanitation systems provide barriers between excreta and humans in such a way as to break the disease transmission cycle, for example in the case of fecal-borne diseases. This aspect is visualized with the F diagram, where all major routes of fecal-oral disease transmission begin with the letter F: feces, fingers, flies, fields, fluids, food. Sanitation infrastructure has to be adapted to several specific contexts, including consumers' expectations and local resources available. Sanitation technologies may involve centralized civil engineering structures like sewer systems, sewage treatment, surface runoff treatment, and solid waste landfills. These structures are designed to treat wastewater and municipal solid waste. Sanitation technologies may also take the form of relatively simple on-site sanitation systems. This can in some cases consist of a simple pit latrine or other type of non-flush toilet for the excreta management part. Providing sanitation to people requires attention to the entire system, not just focusing on technical aspects such as the toilet, fecal sludge management, or the wastewater treatment plant. The sanitation chain involves the experience of the user, excreta and wastewater collection methods, transporting and treatment of waste, and reuse or disposal. All need to be thoroughly considered. Sanitation is about more than just toilets. Behaviors, facilities, and services together provide the hygienic environment children need to fight diseases and grow up healthy. According to the latest WASH-related burden of disease estimates, 1.4 million people die each year as a result of inadequate drinking water, sanitation, and hygiene. The vast majority of these deaths are in low and middle-income countries. Unsafe sanitation accounts for 564,000 of these deaths, largely from diarrheal disease, and it is a major factor in several neglected tropical diseases, including intestinal worms, schistosomiasis, and trachoma. Poor sanitation also contributes to malnutrition. In 2022, 57% of the global population, 4.6 billion people, used a safely managed sanitation service. 33%, 2.7 billion people, used private sanitation facilities connected to sewers from which wastewater was treated. 21%, 1.7 billion people, used toilets or latrines where excreta were safely disposed of in situ, and 88% of the world's population, 7.2 billion people, used at least a basic sanitation service. 2. Diarrhea remains a major killer but is largely preventable. Better water, sanitation, and hygiene could prevent the deaths among children aged under 5 years, 395,000 in the year 2019. Open defecation perpetuates a vicious cycle of disease and poverty. The countries where open defecation is most widespread have the highest number of deaths of children aged under 5 years, as well as the highest levels of malnutrition and poverty, and big disparities of wealth. Benefits of improving sanitation. Benefits of improved sanitation extend well beyond reducing the risk of diarrhea. These include reducing the spread of intestinal worms, schistosomiasis, and trachoma, which are neglected tropical diseases that cause suffering for millions. Reducing the severity and impact of malnutrition. Promoting dignity and boosting safety, particularly among women and girls. Promoting school attendance. Girls' school attendance is particularly boosted by the provision of separate sanitary facilities. Reducing the spread of antimicrobial resistance. Potential safe recovery of water, nutrients, and renewable energy from wastewater and sludge, and potential to increase overall community resilience to climate shocks, for example through safe use of wastewater for irrigation to mitigate water scarcity. A WHO study in 2012 calculated that for every $1 invested in sanitation, there was a return of $5.50 in lower health costs, more productivity, and fewer premature deaths. In 2013, the UN Deputy Secretary General issued a call to action on sanitation that included the elimination of open defecation by 2025. The world is on track to eliminate open defecation by 2030, if not by 2025, but historical rates of progress would need to double for the world to achieve universal coverage with basic sanitation services by 2030. To achieve universal safely managed services, rates would need to increase fivefold. The situation in urban areas, particularly in dense, low-income and informal areas, is a growing challenge as sewerage is precarious or non-existent, space for toilets is at a premium, poorly designed and managed pits and septic tanks contaminate open drains, and groundwater and services for fecal sludge removal are unavailable or unaffordable. Inequalities are compounded when sewage discharged into storm drains and waterways pollutes poorer low-lying areas of cities. The effects of climate change, floods, water scarcity and droughts, and sea level rise, is setting back progress for the billions of people without safely managed services and threatens to undermine existing services if they are not made more resilient. Wastewater and sludge are increasingly seen as a valuable resource in the circular economy that can provide reliable water and nutrients for food production and recovered energy in various forms. In fact, use of wastewater and sludge is already commonplace, but much is used unsafely without adequate treatment, controls on use or regulatory oversight. Safe use that prevents transmission of excreta-related disease is vital to reduce harms and maximize beneficial use of wastewater and sludge. In 2019, UNWater launched the SDG 6 Global Acceleration Framework, GAF. On World Toilet Day 2020, WHO and UNICEF launched the State of the World Sanitation Report, laying out the scale of the challenge in terms of health impact, sanitation coverage, progress, policy, and investment, and also laying out an acceleration agenda for sanitation under the GAF. In 2010, the UN General Assembly recognized access to safe and clean drinking water and sanitation as a human right and called for international efforts to help countries to provide safe, clean, accessible, and affordable drinking water and sanitation. Sustainable Development Goal Target 6.2 calls for adequate and equitable sanitation for all, and Target 6.3 calls for having the proportion of untreated wastewater and substantially increasing recycling and safe reuse. As the International Authority on Public Health, WHO leads global efforts to prevent transmission of diseases, advising governments on health-based regulation and service delivery. On sanitation, WHO monitors global burden of disease, SDG 3.9, and the level of sanitation access and wastewater treatment, SDG 6.2, 6.3, and analyses what helps and hinders progress, SDG 6A, 6B, and GLOS. Such monitoring gives member states and donors global data to help decide how to invest in providing toilets and ensuring safe management of wastewater and excreta. WHO works with partners on promoting effective risk assessment and management practices for sanitation in communities and health facilities based on evidence and tools, including WHO guidelines on sanitation and health, safe use of wastewater, recreational water quality and promotion of sanitation safety planning and sanitary inspections, and through communities of practice such as RegNet and the Sanitation Workers Initiative. who also supports collaboration between WASH and health programs where sanitation is critical for disease prevention and risk reduction, including neglected tropical diseases, cholera, polio, and antimicrobial resistance, and environmental surveillance of pathogens. Aspects of climate resilience are incorporated in all WHO sanitation guidance documents. Poor sanitation puts children at risk of childhood diseases and malnutrition that can impact their overall development, learning and, later in life, economic opportunities. While some parts of the world have improved access to sanitation, millions of children in poor and rural areas have been left behind. Lack of sanitation can be a barrier to individual prosperity and sustainable development. When children, especially girls, cannot access private and decent sanitation facilities in their schools and learning environments, the right to education is threatened. As adults, wage earners who miss work due to illness may find themselves in financial peril. And when health systems become overwhelmed and productivity levels fall, entire economies suffer. Without basic sanitation services, people have no choice but to use inadequate communal latrines or to practice open defecation, posing a risk to health and livelihoods. Even in communities with toilets, waste containment may not be adequate. If they are difficult to clean or not designed or maintained to safely contain, transport and treat excreta, for example, waste might come into contact with people and the environment. These factors make sustainable development nearly impossible. Open defecation. The practice of defecating in the open, such as in fields, bushes, or by bodies of water, can be devastating for public health. Exposed fecal matter contaminates food, water, and the environment, and can spread serious diseases, such as cholera. Coupled with poor hygiene practices, exposure to fecal matter remains a leading cause of child mortality, morbidity, undernutrition, and stunting, and can negatively impact a child's cognitive development. Harmful to community health and well-being, open defecation can also undermine individual dignity and safety, especially for girls and women. When forced to travel greater distances from home to reach adequate hygiene facilities, girls or women are put at greater risk of violence. UNICEF is on the ground in more than 100 countries to provide safe sanitation for the world's most vulnerable communities in rural and urban areas, and during emergencies. We mobilize communities, build markets for sanitation goods and services, and partner with governments to plan and finance sanitation services. In emergencies, UNICEF provides urgent relief to communities and nations threatened by disrupted services and the risk of disease outbreak. We also support innovation in sanitation, improving sanitation technology, ensuring basic toilets are affordable, accessible, and safe, and finding effective, sustainable solutions for sanitation challenges that harm children. Ending open defecation. Ongoing investment in sanitation services by households, communities, and governments is necessary to shift community behavior so that toilet use by all becomes the new norm. Many countries are off track to end open defecation by 2030. UNICEF's commitment to meet this challenge has been mapped in our game plan to end open defecation, a strategy for reaching the 26 countries that account for over 90% of global open defecation. We support governments through community and market-based approaches in rural areas and in urban slums, where most people defecating in the open live. Communities are encouraged to carry out an analysis of existing defecation patterns and to use local resources to build low-cost household toilets and ultimately eliminate the practice. Thank you for watching this video.